is based on work with quite a few authors, almost all of whom are listed at the bottom here. And I'm going to try and cover 7 papers. I'm obviously not going to do that. I'm going to leave out a lot of holes. There are going to be a lot of holes, things that I can fill in at some other time if someone's interested. A lot of what I'm going to talk about people have already covered, so I'm going to have to do a little bit of picking and choosing here. So I'm going to focus on a few uses of the SPM, the ones that the Census Bureau has indicated in their annual report that they've intended for the SPM, and I'm going to look at whether or not the measure is appropriate for those uses. What I'm going to say is similar on this to what Sandy said. The official Census Bureau report says that the SPM is designed to provide information on aggregate levels of need at a national level or within large subpopulations or areas. I'm going to emphasize that, but also head a little bit in Sandy's direction and think about comparisons across groups and even comparisons across individuals, because they then make up groups. I'm going to talk about changes over time as well. I want to emphasize that the census report indicates that the SPM isn't for eligibility or funding, and I'm not going to talk at all about that. So in terms of the conceptual issues in why you might like the SPM, I think here is where there's the most agreement. And I want to pretty directly say that the theme of the SPM resource definition is to make the definition closer to consumption. In the words of the census report, it's resources that families can use to meet their food, clothing, and shelter and utility needs. Now, even there, I think the definition falls short, because income isn't a good proxy for the resources available for consumption. If you think about someone who's having to take a lot of their income and save it for retirement or for a rainy day, then their income, their full income really exceeds what's available for consumption. And in the same way, if you look at someone who is retired and drawing from their savings, then again, their income is not really a good indicator of what's available for consumption, because they're able to draw from their savings. And so what their current income is may be largely irrelevant. The resource definition also does a poor job of capturing the value of home ownership. And it misses car ownership entirely, which are big parts of consumption. Housing and transportation are almost half of consumption for the poor. And the SPM really isn't designed to get those well. So the other complaint that I have about SPM resources conceptually is that there are some basic questions about medical out-of-pocket spending that I don't think have been answered in the literature. Why is it different from other spending? We think of it as a necessity, but how much of it is a necessity? How much of it is discretionary? Why not subtract out food or housing from resources? Just to illustrate the issue to think about. We need to know whether or not MOOP being high tends to reflect resources being high. People are able to spend a lot on MOOP because they have high resources, or because it reflects need. And I think a lot of the evidence that I'm going to show you later suggests that MOOP may often be high because of high resources rather than high need, high ability to spend. So in terms of practical issues with the SPM resource measure, the SPM is based off the current population survey, which has crippling underreporting and imputation problems. So over 60% of cash welfare is missed, 75% of housing benefits, almost half of SNAP. There are a lot of other income sources that are badly measured: unemployment insurance, workers' comp, supplemental security income, pension income. And since there are a lot of people that heavily rely on one or just a few of these sources, if you miss them or dramatically underreport them, then there is a major misclassification of who's poor. So here's some numbers from a paper with Mittag, and this is from 4 years of current population survey linked to New York administrative microdata. And what you see is, if I can, doesn't look like this is working for me. Well, 43% of SNAP recipients don't report it, 63% of public assistance recipients don't report it. Those are TANF and general assistance recipients. 35% of housing assistance recipients don't report it. And when you look at people who do report and look at what their report is compared to what the government paid out, in the case of public assistance, 40% is missed among recipients. And then for housing assistance, 3/4 of housing assistance is missed. Now that's not an amount reported, that's an amount imputed, but that's because the imputations are so poor. So all of California is in one region, I believe. There are 5 regions for the entire country. That's the geographic distinction of the imputation. And it's based on a survey from 30 years ago. So what we've calculated here is just the contract rent and then subtracted off the tenant payment. That's our measure of housing assistance. And the correlation of that with the imputation is 0.07. So the measurement errors are just overwhelming here. Now, what we then did was figure out if you add the unreported transfers for just 3 programs, and they're not the 3 biggest, public assistance, SNAP, and housing. You take the unreported part and you calculate how much of that is, how that compares to what is reported for those with incomes below half the poverty line in the CPS. And the unreported part of just these 3 transfers is equal to 110% of what is reported for income for those below half the poverty line. Okay. Now, there's also other people who have done some calculations like this. B and Mitchell have recent work looking at the elderly and find that if you bring in missed pension income, they use tax records and Social Security records, that reduces the CPS income poverty rate by 2 percentage points. And for it's 4.5 percentage points for the older elderly, the oldest elderly. Now, these are the conceptual issues and some of the empirical evidence. What about how the measure does compared to other measures of well-being? I think the acceptance of the SPM resource measure is largely based on faith, not evidence. What Jim Sullivan and I do is we take a look at the association of the SPM measure with other measures of well-being. And what we find is that the association of the SPM with other measures of deprivation is low, worse than the official poverty measure. That was not what we were expecting, but it comes out quite strongly. On the other hand, consumption-based poverty is much more closely associated with other measures of low well-being than the official poverty measure. So let me just explain this 2x2 figure. So you can think about how two different poverty measures classify a population, and the diagonals are people who are classified in the same way as poor and not poor by the two measures. And then the off diagonals are the ones that are classified differently. And we always set the thresholds so that the two measures give you an equal number of poor, meaning that the off diagonals are the same size, that each measure adds the same number of people to the poverty, the group of poor that the other does not include, okay? So then we look at the characteristics of those added to the poverty rolls by the SPM, those added to the poverty rolls by the OPM. And we look at a number of characteristics here: consumption, health, ownership of cars, characteristics of housing, ownership of appliances, education, particularly whether the head is a college grad, and then asset measures. And you see that of the 25 we looked at in the consumer expenditure survey, all 25 favored the official poverty measure over the SPM. When you look at consumption versus the official poverty measure, 21 out of 25 favor consumption rather than the official poverty measure. So it's clear that the SPM is not very highly associated with other measures of deprivation, which is troubling. Now, we've also done this for subgroups, done this using the CPS, where you have a smaller number of indicators, done a version of this with the PSID, but we're looking at percentiles rather than specifically like a 15% poverty cutoff. You see this still within demographic groups, defined by age, or just looking at kids, or if you look at different family types. Now, thinking about the SPM rather than at a point in time, over time, the CPS is not close to an unchanging measuring stick, and the accuracy of the CPS is declining sharply over time for the poor, rising non-response, rising imputation, rising measurement error. The last two are really the most important. And underreporting is getting much worse. So here we're reporting the proportional bias in the reporting of really in the end 9 different transfer programs. And say we've done it for 5 different surveys here. This is for a 14-year period recently. And take a look at, in the first column, the CPS number. That says that half of TANF has been reported in the CPS over the last 14 years. And you can see in that row that all of the numbers are negative. There's a lot of underreporting of each of these programs. It's a little bit lower for Social Security, OASI, and for SSI, but some of these numbers are pretty dramatic. Now, what's happened over time, if you take those proportion of dollars that appear in the survey, that was the proportion that was paid out that appears in the survey, and regress it on a time trend, you get, in, say, the CPS row, 5 out of 7 of the numbers are negative and often pretty big. If you say, look at the one in the first column, the minus 0.71, what that means is that over 10 years, that if this relationship continued, what it would imply is that the percentage of TANF reported would go down by another 7.1 percentage points from its averaged half, 50, it's averaged 50% over the last 14 years. Okay. So things are getting worse. Now, the exception there is OASI, that's Social Security, retirement, and SSI. And those are really more the exceptions that prove the rule. If those numbers that I just showed you include in the dollars that are considered to be reported, those are imputed, which are often not very accurately imputed. That's what the comparisons to administrative data show. And this shows that the share of dollars that we're including that are imputed have also gone up quite dramatically. So OASI started at around 20%, 91 here, and it's now about 35% of the dollars that are considered to be reported are guessed at in some way. Sometimes the guesses are good, sometimes not. So, and SSI, again, that the share of dollars imputed have almost doubled. Okay, so what are alternatives if you want to measure, come up with an income poverty measure? Well, the ACS, it's great in that you can get a lot of geographic detail, but it doesn't ask about some of the key programs. So it doesn't have food stamp amounts, doesn't have public and subsidized housing. The SIP, much better program reporting than what I showed you for the CPS. But again, it's sort of the exception that proves the rule because we're no longer collecting information 3 times a year. We're going to once a year because it was so expensive. And there's a nice paper by Gathright and Crabb that looks at the reporting of Social Security and SSI that were our good examples earlier and shows that over time, almost every dimension of quality of the reports has gone down substantially. And that's based, again, on links to administrative data from the Social Security Administration. So what are other alternatives? Consumption. I'd like to argue that there should be a lot more research on how best to use consumption to measure well-being. We probably should devote more resources to figuring out how to improve our consumption data. We have an army working on income, measurement of poverty, and only a handful of soldiers working on consumption. Now, many key components of consumption are measured well in the Consumer Expenditure Survey, others are not. So I wouldn't advocate just taking all of consumption, or at least I would advocate considering subsets and seeing what you get with subsets as well. So here's rent and utilities. Over time, close to 100% of it has been reported, and it's been pretty constant. So this is a ratio of the dollars reported in the Consumer Expenditure Survey relative to national income accounts. So this is separately for the interview and diary. Okay. And then here is food at home. Again, the numbers look pretty good, though there are some real problems in the 80s that are well known. Again, but here it's about 90% is reported. Gasoline and other energy goods starts at about 100, deteriorates down to around 85, goes up and down a bit. On the other hand, if you look at food away or clothing, things are really quite bad. So only 30% of clothing appears in the interview survey, half in the diary. Okay. So fortunately, you can use just a few components of consumption, and those sum up to a large share of total consumption, especially for the poor. And subcomponents of consumption, like food or food plus housing, provide a reasonable measure of well-being and are commonly used as summary measures. So that makes obtaining a good consumption measure easier to achieve than a good income measure. Okay. In terms of conceptual advantages, consumption captures lifetime resources, not transitory income. You can get the flow value of home ownership and vehicle ownership if you spend a fair amount of time with the data. One of the criticisms that I frequently hear about consumption, I just want to mention it here, is that people are worried that you might have people overspending, so that consumption then would not be a good indicator of well-being. But if you're overspending, spending beyond your means, you're living in the house, you're driving the car, you get the benefit of it. And so then at that point, I think a better measure of well-being really is the consumption rather than the income. If there's another period where a person has to pay back a loan and their income greatly exceeds their consumption because they're paying back a loan, you want to know that too. You want to measure their consumption in that situation as well. Now, there is a divergence between income and consumption measures of poverty, particularly in the last 15 years. And there's a divergence that's even more noticeable over a long period of time for deep poverty and poverty gap measures. So this looks a lot like the Weimer et al. Numbers on anchored SPM. The blue line is the official line. The other two lines are an after-tax income poverty measure and then a consumption-based poverty measure. Those two lines use a different price index than the official measure. And here we've gone beyond Sandy's preference for the PCE, taking the evidence that even the PCE overstates the rate of inflation. And what you see is that starting around 2000, there's a noticeable divergence between the income and consumption poverty measures. Okay. If you look at deep poverty, or you look at a poverty gap, the divergence is greater, happened earlier. We think that that's the underreporting of transfers that we saw that I documented earlier. So the bottom line is a gap measure. All of these are anchored to be the same in 1980, and then the other series are the income measures. Okay, so let me not dwell on the SPM thresholds and talk about weaknesses of consumption and conclude. Problem with the consumption data is that sample size is small. So you can't get good estimates of small subpopulations or small geographic areas. Data quality is less understood. It's harder to get at because you don't have administrative data in many cases, and because, frankly, the BLS has been less interested in trying to link their data to things that it can be linked to. It can't be used for eligibility, neither can the SPM. I think people are worried that consumption poverty measure could indicate that the poverty rate is low, which worries some. But again, as Sandy said, the thresholds are arbitrary. So you can make a consumption poverty rate as high as you want. Just pick the thresholds right. And what we generally do in our work is we make them the same in some base year, usually 1980, by setting the thresholds so that happens. So going forward, how do I explain my so negative view of the SPM? Well, you start out with a survey that has a lot of things that are missing, badly measured, and you add to it a lot of things that are badly imputed. So I don't think it should be too surprising that it doesn't do very well. So then, what could we do? Well, it's not on this slide, but one thing that various people are working on is linking the CPS to lots of administrative data sources so that you can benefit from the advantages of both administrative data and the survey data. And I think it won't be long before we have the CPS linked to 1040s, as well as information returns, as well as lots of the transfer program administrative data. There are various efforts. I can see Pat Ruggles acknowledging that a lot of this is very far along, and we won't have it for all states. You know, it's going to be still kind of fragmentary, but I think that's probably going to be a lot better than our current income measurements. I think we can also make consumption a lot better. Currently, they've stopped releasing some of the detail on owned vehicles, which made it possible to do a really good job of imputing the value of cars. It's harder to do that now. We could increase the sample size of the consumer expenditure survey, stratify by state, and then you could get better geographic measures. There are probably other changes we could think of. So let me stop there.